So I get tons of questions related to probiotics, and it can be really confusing with all the info you guys see out there. Kind of what to know is important. Is it really important at all? What's the difference between all these things? Prebiotics, probiotics, where should I start? So I'm going to try to offer a little bit of clarity on that today. So first and foremost, probiotics really, really matter. And our gut flora microbiome really, really matters. And it affects many areas of our health. So for patients who have really destroyed gut microbiomes for some reason or another, they have immune problems, weight management issues, sleep disorders, skin disorders, endocrine and metabolic challenges. And now we even have lots of evidence about mood disorders and how there's their own strands of probiotics called psychobiotics, which actually address that and help maintain a lot of our neurotransmitters in the right ranges. So this really matters. And the cool thing is you just get a little educated about it and then you can do something about it. It's really not that big of a deal. Of course, diet and things play into it and stress levels, but we can feed our gut microbiome what it needs and help it to work the best that it can. Kind of like maintaining a car where you change the oil, make sure the fluids are right, make sure the gas is right, and then it will perform like it's intended to. And if you don't do those things, it's not going to perform like you would expect it to. So why is this a bigger deal now? Why did our grandparents not have to take probiotics and they weren't talking about them all the time? So of course, part of that is research is caught up. But the other part is think about how we grow food and how we don't mix, cattle and livestock with a lot of our farming anymore. A lot of that has been isolated out for mass production, quick production. Those things, along with a lot of the chemicals we use on our soil and overusing our soil and ways we preserve and prep food, all that stuff strips away the good bacteria that we used to just get from regular farming and farm life and how the cattle and livestock would fertilize the land and all the kind of life cycle stuff that used to be an old school farm. Lots of over-the-counter medications and things like antibiotics can also affect your gut flora. So of course, sometimes we have to take antibiotics, best to avoid them at kind of all costs, but when you got to, but you need to do things afterwards. It can take up to 6 months of actively trying to rebuild your gut flora to get back to where you were pre-antibiotic days. So that's important to know. So the difference between prebiotics versus probiotics. So these are things you need to think about when you've decided, okay, I understand there's enough research out there now. I want to do something and empower myself and feel better. Where do I start? What criteria do I need to look for? You should have prebiotics in whatever system you decide to use. So this is food for the good bacteria. You need probiotics, which are actually living strands of bacteria that we want to make sure we're maintaining and replacing. And then also there's a constant battle between good bacteria and bad bacteria and kind of fungus overgrowth and yeast overgrowth. And when your good bacteria gets too low, the yeast overgrowth can get too high and kind of wreak havoc and cause a lot of problems. So how you kind of reel that guy back in is with digestive enzymes. So prebiotics, probiotics, the correct digestive enzyme to handle killing off yeast. And then of course, everyone wants to know about temperature and price, and are the expensive ones in the fridge always better than the other ones? So you got to do your research, and I'm happy to talk to you about the ones that I have found to make a big difference with me and my kids. But mine are flash frozen. And so what that kind of does to the live strands is puts them to sleep, puts them dormant until they hit moisture in your digestive tract. And then they kind of wake up and do their thing and come back to life. So what happens if you decide, I don't really care about probiotics, I don't really want to deal with my gut microbiome, I'll just try to eat healthy. It's very difficult. It is good to eat things that promote a good gut microbiome, but it's very difficult in our life to keep up with the level that you would need to. So we always encourage that, but this fills those gaps that unfortunately we just run into. And left alone, it can lead to lots of struggles, some of which we've talked about. We could talk for hours about this, but another one of them is called leaky gut syndrome, which you've probably heard mentioned. And what that means is in our intestinal walls, there's actually these things called tight junctions where it affects the permeability of what we eat and what gets digested and then what gets kind of sent into the bloodstream for our body to use. Things like gut microbiome getting out of balance can actually loosen these junctions and literally cause the membrane walls to be leaky. That means stuff is getting into our bloodstream that we don't want in there and in quantities that we don't want in there. And that starts to cause all sorts of secondary and tertiary challenges for our body. Leads to a bunch of inflammation, which ends up kind of feeding the bad cycle, and is thought to be tied to a lot of autoimmune disorders and other struggles that people have. So this is an easy thing to address, easy thing, relatively low cost. You've got to experiment for yourself. I've tried a few different strands and a few different products, and I really like the ones I'm at. And that's what I encourage you to do. Try some out, see how you feel, see what works best for you, but definitely do something for yourself, because this is legit and it's an easy way to maintain better health.